Hello, I'm Dr. Jonathan Silverberg. I'm a professor of dermatology and director of clinical research and patch testing at the George Washington University School of Medicine and Health Sciences in Washington, D.C. There have been a number of recent guideline updates that have been published for atopic dermatitis in the United States, throughout Europe, Asia, etc. And each of these is meant to provide a framework for how we can approach the management of patients with atopic dermatitis. But I'm careful in how I say that. It's a framework. It's not meant to be rigid, you must do X, Y, and Z. And so it gives us a sense of how should we approach the patient assessment? What are our options within the topical realm? What are our options when the topicals are not adequate? How should we think about safety, efficacy? What's first line, what's second line? But keep in mind that none of these are ironclad or meant to be used rigidly. So I'll give you an example. In some regions, oral JAK inhibitors are approved as second-line systemic therapies, where they should have had already an inadequate response to previous systemic or biologic therapies. That would be the on-label indication as per that particular region. But for some patients, they need an oral JAK inhibitor now as their first-line therapy, and they shouldn't have to step through some other biologic. So there's the recommendations that are in the guidelines as rough recommendations or general recommendations, but you have the license as a clinician to individualize therapy to patients. And if something that's in the guidelines that's recommended as the next step is not appropriate for patients, it's okay to skip that step and find an alternative.